Good afternoon, everyone. I'm Sam Peck. I'm the Executive Director of Family Councils of Ontario, and it is my pleasure to welcome you to today's June 2022 Regroup, Refocus, Recharge virtual conference session. I've said this before, but we are all so pleased to connect and learn with you as we celebrate June, celebrate throughout June. We have Seniors Month, Pride Month, National Indigenous History Month, and Family Council Week. It is so important to be able to learn about these important celebrations and observances. And I have a slide deck, which you'll see on the side. And there's going to be a link that pops up in a sec that is a really great one for you to, no, I don't have it up there yet. But before we go any further, I want to take a moment to acknowledge the land on which I'm coming to you from. It's National Indigenous History Month, so this is one step you can take to acknowledge this celebration. I'm based in Hamilton, and that's situated upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. FCO is an entirely remote organization, and we work with people all across the province. Through that, we encourage everyone we work with, team members, service users, partners, to reflect on the enduring legacy of colonialism and engage in reconciliation meaningfully. There's a great website, native-land.ca, or another one is whose-land, to learn more about the territory your home is situated on. It may seem like one small step, and it is, but the work that non-Indigenous organizations and people need to do towards reconciliation with Indigenous peoples is a long-term journey. It's specific to each person, and it's constantly evolving for our organization. But we welcome you to join us on our journey and learn together. I've actually heard from several councils that hearing the land acknowledgement has inspired them to do one at their local council meetings, to learn more about the communities around them. And it warms my heart to hear things like that. Before we get into today's session, I want to remind you of the other great events we have coming up. Later this week, on Wednesday at 6:30 p.m., join us for the third installment of our monthly long-term care book club as we continue reading Moira Welsh's Happily Ever Older, Revolutionary Approaches to Long-Term Care. For this session, we'll be joined by Moira herself, so it's very exciting. Thursday at 1 p.m., join Deborah Bakhti in conversation about the emotional journey into long-term care, both her personal and professional experiences, and her book, Now What? And then we're going to close out our conference, our time together, 1 week today. That is June 27th. Bring your favorite beverage and a deck of cards to our closing evening social featuring an interactive magic show. The FCO team will be there for a fun evening where you'll get to connect with us and your peers, be entertained with a magic show, and learn a card trick from Toronto Magic Company's Ben Train. So bring a deck of cards and play along. If you want to help us deliver more great sessions like those, consider becoming our friend, specifically a monthly donor, a friend of FCO. Regular monthly donations enable us to predict future revenues that we can use for special events and projects like this virtual conference. We couldn't do it without your help, so we extend our deepest gratitude. If you want to know more about our Friends of FCO monthly giving program, visit our website. But now, without further ado, we're going to get into today's topic. It is the role of social workers and social service workers in long-term care. It's a topic that is near and dear to my heart and one that FCO has been exploring for quite some time now. And so it'll be my pleasure to give it over to introductions, starting with Dr. Susan Bradley. Susan, introduce yourself.
Hi, I'm Dr. Susan Bradley, and I'm a professor at the School of Social Work at Carleton.
Great, thanks so much. We're also going to be joined by Michelle Fleming from the Ontario CLRI at Briere. Michelle.
Hi there, it's nice to see everyone, or well, see those of you that I can see. I'm a knowledge broker with the Ontario Centres for Learning, Research and Innovation in Long-Term Care, hosted at Bruyere. And my background is having worked as manager of social services in long-term care for about 12 years prior to joining the CLRI almost 5 years ago.
Welcome, Michelle.
Yes.
And we are joined by a long-term care social worker, Candace Hind. Candace.
Hi, everyone. Yes, I'm Candace Hind. I am an MSW, RSW, registered social worker working in long-term care. And I have worked in about 14 long-term care homes in arts and aging over the time. And this one that I'm going to talk about today, I've been with for about 8 years. So happy to be here and talk about our role.
Thank you. And also myself, but I've already introduced you to me. So today we're going to be talking about research evidence on social work and social services and the contributions to quality care in long-term care homes in Canada, and a description of what these folks have been contributing during the COVID-19 pandemic in Ontario's long-term care homes. So as I mentioned, it is a really important topic, one we've been working on for some time. But before we get into that, it's my pleasure to hand things over to Michelle.
Great, thanks, Sam. So this work is being done in partnership by the Ontario CLRI, Family Councils Ontario, and Carleton University. We'd like to just acknowledge that this work is being supported by the Government of Ontario through the CLRI. Now, you may not have heard of the CLRI before today, so I just wanted to take a moment to just tell you a little bit about who we are and what we do. So the Ontario Centres for Learning, Research and Innovation in Long-Term Care, it's a bit of a mouthful. This is why we use CLRI for short. We are here to strengthen the quality of life and care for residents living across the province. We're a program of the Ministry of Health and the Ministry of Long-Term Care, and we act as a resource for people that are working in long-term care homes. Our aim is to enhance the health and well-being of people who live and work in long-term care. And we do this by providing education and training, by sharing research and innovations, and also by identifying and developing resources for folks working in long-term care. We partner regularly with folks from the sector, partner regularly as well with Family Councils Ontario, and we really focus on providing solutions for priority issues, including COVID-related challenges for homes and future workforce engagement as well. So our program is hosted at 3 different sites throughout the province. We're funded by the government, as I mentioned, and we're hosted at Baycrest Health Sciences in Toronto, at Bruyere, which is in Ottawa, that's where I'm located, as well as the Schlegel UW Research Institute for Aging in Waterloo. And our program aims to support all of the 630 long-term care homes in the province by engaging in initiatives that help bring evidence-informed resources and tools to those working in the sector. And today we're going to talk a little bit about how we do that in relation to social workers and social service workers. And I'll turn it over to Sam.
Thanks. If you don't know, like the CLRI, FCO works with all of the long-term care homes across Ontario. We have a similar mission to lead and support families in improving quality of life in long-term care. So we work with our partners like the CLRIs, like researchers and more. We work to cultivate effective councils, mobilize knowledge exchange, which is something that you're joining us for today, and advance public policy, system planning, and research. Now, let's get into the reason why you're all here today. What are we going to talk about? So Michelle, Susan, Candace, and I delivered a similar session as today's to the Ministry of Long-Term Care's Pandemic Community of Practice several months ago. And as we were coming up with the presentation and really thinking about what do we want to share with people, this is the vision that we articulated. We all agreed we want vibrant, safe long-term care sector in which all long-term care homes have social workers on staff. And you'll hear a little bit more about the why behind that in a few moments. We want a sector where social workers have the tools and resources to perform their full scope of work. You'll hear a great example of that work through Candace's story later on. And we want social workers and social service workers to provide resident and family-centered, culturally supportive care that adds life to years, not just years to life, and to bridge the gap between the biomedical healthcare model and emotion-focused relational care. And that ultimately that families and residents receive the psychosocial support they need to thrive as members of the long-term care community. And also, this is very much related to the world we're living in right now. Long-term care is facing an a Health Human Resources Crisis, or HHR. Homes across Ontario, and I'd also say across the country as well, have been unable to recruit and retain staff. This is staff that are PSWs, nurses, medical directors, dietary and environmental services folks. We are in a human resources crisis. The ongoing COVID-19 pandemic has devastated long-term care homes. And as you folks would probably know better than anyone else, the immense grief, fear, frustration, and sadness that is shared by residents, families, and staff. So in this bit of a perfect storm of homes being understaffed, a global pandemic with devastating effects in our long-term care homes, there is now more than ever a need for staff, residents, and families to work together collaboratively and to have the supports that they need to do that. But this is also not a new discussion that we're having. Back in 2018, with a placement student from what is now Toronto Metropolitan University, FCO started a research project. And it was a piece of work that was developed in response to growing concerns from staff, so social workers and social service workers, and caregivers as well, about the availability and offerings of supports for families. So we did a project that did some quantitative and qualitative research, not a huge sample size, but what we found were these themes that emerged. For families, they said that the value of social workers and social service workers in their homes was around transition support. So transitioning from being a caregiver in the community or hospital to long-term care and everything that comes with that. So learning essentially a new language, a new way of doing things in long-term care, building new relationships with home staff, the emotional journey. All of that was much improved for folks who had access to a social worker or social service worker. For those who didn't, the experience was much more stressful. We also heard that social workers were good conduits to getting education, whether that was issues within the home. So how do menus get developed? What is medication timing like for people living with Parkinson's? Things like that. Or outside sources of information. So Alzheimer's Society, for example, or learning about caring for the caregiver. Social workers were often best positioned to provide that information to families and to councils. But what we also heard a lot was families wish they could have more contact with the service providers, more opportunity to engage in proactive discussions, not just a crisis. That when social workers, or if there's only one or one part-time for a home of several hundred residents, families didn't have a lot of contact with that social worker or social service worker. But when they did, it was so valuable and meaningful to improve their experience. We also heard from families that they recognize the expertise that social workers and social service workers bring to the table. But they felt that wasn't well recognized more generally, that they saw social workers not having clear role definition. And that's something we heard from the providers as well, that these educated, experienced folks were doing things such as tours of the home, which, while there might be an important part of that experience for families where being able to make contact with a social worker is valuable, having someone do the tour of the home wasn't necessarily the best use of that person's time when they could be doing counseling, helping to provide new families with valuable information and support. As I said, that's also something we heard from the providers themselves, social workers, social service workers, that while they may have all had the same title or something similar, their roles varied quite a bit. So there was a real lack of, and I hazard to say continues to be, a lack of role consistency and definition within legislation. And even in the new Fixing Long-Term Care Act, we don't have that consistency or clear definition there either. And while there is definitely and needs to be room to adapt the role and the work based on the unique needs of that home, there still should be greater consistency in terms of what these professionals are offering in long-term care homes and what families can expect from that experience, that when they avail themselves of the services of a social worker or social service worker, their experience should be similar across different homes. Because social workers also recognize they wanted to give more support to families. They were spending much of their time dealing with crises, whether a resident or a family, and they wanted to be able to be more proactive and really help people with an issue or an experience before it hit a critical point. And so, in order to help social workers and social service workers better learn from each other, discuss what their roles were, how to increase support to families, really learn from each other, with the Briere CLRI, we launched a community of practice. And so Michelle is going to give you more information about the themes that have emerged from that work.
Thanks so much, Sam. And yeah, what you're going to hear is that a lot of the things that Sam has just been talking about that came up in 2018 have come up throughout the past couple of years that we've been running this community of practice. So in the early days of COVID, Sam and I got together and we were brainstorming ways that we could help support the folks that are working in the long-term care homes to feel less isolated, and, as she was saying, encouraging that dialogue and resource sharing. We know that in many homes, if there is a social worker, social service worker position, there's often only one, and it can be a really isolating experience, as I know firsthand from when I used to work in long-term care. So in May of 2020, so in the early days of COVID, we began this COP, meeting virtually on Zoom on a monthly basis. So we bring together social workers and social service workers that work in long-term care across the province to talk about the timely and relevant practice issues with their peers. And we basically created a space where we can share resource and offer some mutual support. And so we wanted to share with you some of the key themes that have come up over the last 2 years. So we heard a lot about specific practice-related issues. So changes that happened to the role throughout COVID-19. And as I'm sure you all know, COVID flipped life upside down in long-term care. And these professionals that are social workers and social service workers have a high degree of empathy, are deeply committed to supporting resident quality of life. And what we saw was a lot of moral distress experienced by these folks because of the challenges that were happening due to COVID, and because of the need for the homes to just utilize these professionals in whatever way was necessary during those times when they were thinly resourced. And you'll hear a bit more from Candace shortly about what that actually felt like on the ground. We also heard a lot of frustration around the lack of understanding of what a social worker actually does. Lack of understanding by their peers, by leadership, by family, and also by residents as well. So this sometimes will lead to situations where the social work scope of practice is not being maximized, and sometimes they're also being utilized inappropriately or ineffectively. We also heard that they were really wanting to learn how their peers in other homes were managing some of the different aspects. For example, care planning, conversations with families around palliative care, strategies for interprofessional collaboration came up a lot as well. What cognitive assessment tools are people utilizing, and how can they support transitions? So there were a lot of really powerful conversations that took place. Also, conflict resolution was something that came up a lot. Conflict between roommates, conflicts either within families happening or between families and the team that works in the long-term care home. So social workers are often navigating and helping to support conflict resolution as a key aspect of the role. We also heard, as another theme that came up, was just the COVID-19 contextual challenges. So we heard a lot on a regular basis about all of the stress and trauma, fatigue, and burnout that was happening among the teams. We're also hearing a lot about the impact of the high turnover of staff and the shortages. This was impacting everybody on a deeply emotional level. And we talked regularly about strategies to support their own mental health throughout these times. And we also heard a lot about, during COVID, this focus on infection prevention and control, and that leading to almost a reprioritization of the institutional and medical model, kind of taking over the changes that many of these organizations had started to make in shifting their culture towards a more person-centered or social model of living. So things were regressing to a more medical model, which was deeply frustrating for folks. They talked about how many of the new team members who were joining during COVID, they didn't know about the before times. They didn't know about the shift that had been happening, where organizations were starting to feel more like a home, more like a community. Another thing we heard a lot about were the ethical dilemmas that come up, and social workers are often very deeply involved when ethical dilemmas come up within the home. So issues around consent and capacity, issues balancing safety with residents' right to live at risk. This came up so much throughout the pandemic. Complex family dynamics as well, and also advanced care planning. So one of the things that this group does on a regular basis is do some problem solving within a group setting. So sometimes one of the members will present a situation that they're dealing with, and other folks will jump in with suggestions, point to tools and resources. We've also had some guest speakers come as well, including a clinical ethicist who came in the fall of 2020 to talk about consent and capacity and some of those issues that come up around advanced care planning. And the fourth and final theme that we've heard come up a lot is equity issues. Recently, we heard about barriers that are experienced by residents in accessing dental work and logistical issues. There are funds available for this dental program through the province, and they increased the funding for this. However, when you consider transportation and an escort that needs to get paid for, unfortunately for residents that have lower income, it's just not feasible. So although they have access to the dental benefits, you can't actually get them there to receive that care. We also heard a lot about frustrations around the public health measures that were in place. The restrictions that existed for those living in long-term care were so different from what was being experienced at the same time by seniors living in the community. And these differences were quite distressing and confusing for residents, for teams, as well as for social workers who were trying to support the residents through this time, who, of course, as we all know, became increasingly more isolated with more serious impacts on mental health. So a lot of big subjects came up, and many of the members have talked about how having this space to come to on a monthly basis was so beneficial, because they knew that there was a space that they had where they could talk about what was going on with others, peers from that same professional background who had the similar concerns, help them feel less alone, essentially. Now, one of the things we've done recently with the group is we've gone through an exercise to prioritize education topics that they want to learn more about. And so wanted to share with you all some of the topics that came up. So one of the highest rated was supporting families through complex situations. So this is a key element of social work practice, as Sam had talked about earlier on. The topic that came up second most is palliative and end-of-life care. So how do you support those conversations when a palliative approach to care is being implemented, and how to support residents and families through that? They also are really wanting to learn more about supporting resident mental health and those responsive behaviors. What are the best strategies that they can utilize? And they also talked about supervision and mentoring. And we're hearing from many of them that they're needing more support in this area than they're receiving. And like we talked about already, oftentimes they are the only social worker or social service worker in the whole home. So there's a need for more learning in these areas. So we are arranging guest speakers for the group every 3 months going forward. And these themes have basically give us a bit of insight into what social workers are wanting to learn more about so they can enhance their practice. And we'd love to hear from any of you as family members, as care partners. What are your thoughts around areas that you think social workers could potentially benefit from learning more about? We'd love to hear from you if there's topics that you think would be of interest. So I'd like to hand it over now to Susan, who's going to talk a little bit about framing things in the context of the research.
Hi. So Michelle and Sam brought me into this project as a researcher who, for over a decade, has been looking for promising practices in long-term residential care internationally. So with a large research team, we've been in 6 provinces and 6 countries looking for promising practices and making that information available to long-term care homes across Canada and elsewhere. We've been in the US, we've been in Sweden, we've been in Norway, in the United Kingdom, and in Germany, and we've learned a lot. But in this project, we went to the academic and gray literature to say, what do we know about long-term residential care social work and social services work? What have we learned from the studies on this topic? I'm just going to switch to the next slide. And what I want to tell you is we don't know much. First, we do not have high quality evidence about the impact of social work on the quality of care in Canada for 3 reasons. First, there's not much research on these roles in Canada. Second, we can't assume that evidence from other countries applies to Ontario and Canada directly. And I'm going to talk about that a little bit in a minute. And third, social work is really tough to quantify. And so it's tough to measure. And I'll talk about that as well. So this is in real contrast to the high quality evidence we have for nursing, for example. We know from the research that having RNs involved in care improves resident outcomes that we measure on an instrument that is used in most of Canada and in many international countries called the RI-MDS. These studies have been done in many countries, and the role of a registered nurse is quite consistent across those countries. And the improvements are also consistent. My colleague Charlene Harrington has led much of this research, showing that high RN staffing levels are associated with better resident quality in terms of fewer health concerns, lower pain, and improved activities of daily living. Also, there better independence, less overuse of antipsychotics, and lower mortality rates. There's also a strong relationship between higher nursing staffing levels and reduced emergency room use and rehospitalizations. And the strongest relationships are found between higher nursing staffing levels and lower violations of regulations for poor quality. In Ontario, we have a ratio of about 1 RN to 124 residents, and we can say with confidence, based on the literature, that more RNs would improve care. And I tell you this example because I'm going to contrast that with social work, where we know much less, and we know it differently. In the US, every nursing home with 120 beds or more must have at least 1 full-time social worker. All homes must have some social work as a part of service delivery. So, we went and looked at the US case. We thought, oh, maybe we can find some really good, promising practices to talk about in Ontario. But we learned that social work positions do not have to be filled with a licensed social worker or social services worker. And recent literature shows that only 1 in 3 of these positions was filled with licensed professionals. In my research, where I actually went to the US and went to these homes, I found positions were filled with people sometimes with business degrees, and the jobs focused on cultivating relationships with doctors to get referrals and keep beds filled. But at the other extreme, I met masters of social workers with advanced gerontological training who were facilitating person-centered dementia care from admission to death and working with staff and families to adapt to the distinct cultural, spiritual, and linguistic needs of their residents. In Canada, we don't see this extreme differentiation in credentialing. The research that offers the best evidence focuses on nursing homes with credentialed social work staff, often with advanced training in gerontology or dementia care, and a clearer, but not necessarily clear scope of practice. However, understanding the relationship between social work and quality of care is really challenging to assess because social work contributions are unlikely to directly correlate with the kind of measures collected to assess long-term care quality. These measures are things like pressure ulcers, falls, transfers to hospital, and more that tend to be medically oriented and assess the absence of problems rather than the presence of good things. Social work tends to be about the presence of good, but less quantitatively measurable quality, as I will discuss. So while the evidence linking social work to quality of care is limited, there is evidence on the contributions social work is making most consistently, which we've synthesized into 6 categories. And after I've outlined them, and I'm going to be brief here, Candace will offer some practice illustrations. So first, social workers regularly manage transitions to care. As Michelle mentioned, the community of practice has been talking about this. And as Sam mentioned, this is what showed up in the 2018 research that was done by FCO. So transitions to care from home, hospital, community, orienting residents and family members, developing plans for the move, supporting and validating people who are experiencing grief, guilt, anger, stress, sadness, overwhelm, and adjustment. Social workers have expertise in psychosocial adjustments and family work, and they do this work well. Social workers are also involved in care planning, including end-of-life or advanced care planning. They're able to sort out what the resident wants and needs as opposed to maybe what caregivers want for them, making space for resident autonomy and choice, and negotiating care planning for, as one example, a gay man who had come out during his 60s and whose children would actually like him back in the closet. Care planning benefits from the considerable psychosocial skills and knowledge that social work training offers, allowing social workers to educate and respond to families and residents about their concerns. The third thing is that one of the higher demands on social workers is for psychosocial and mediation support and consultation. And again, my colleagues have talked about this quite a bit. Further, staff often look to their social work colleagues, so other trained staff, for psychosocial support around their own emotional health. And that creates some ethical dilemmas for social workers. We're not really supposed to be providing support and treatment to our colleagues. And yet in long-term residential care, this happens quite often. Finally, social workers are often asked to mediate conflict occurring among residents, family, and staff. So fourth, social work is all about relational care that attends to social locations, including race, culture, sexuality, gender, immigration, status, religion, and more. And recent evidence shows social workers deploying that training in nursing homes, providing in-house expertise on these matters, taking the lead in some cases on developing culturally sensitive care that addresses both residents and staff members' social locations. Now, not all social workers have been trained in this work, but it is becoming something that is part of social work scope of practice and really supports that no resident should be treated in racist, sexist, or homophobic ways, but neither should staff. And social workers are increasingly using their skills in this area. Fifth, social workers, and this didn't come up in other sessions, but social work professionals are also doing a significant amount of volunteer coordination and oversight, from recruiting to training, scheduling, supervising, and developing a sense of community among volunteers. And finally, social workers are often co-leading dementia education and facilitation. As the psychosocial dimensions of dementia care are among the most important to quality of care for the population, sometimes called emotion-centered care or butterfly, Eden, green, or other models of care. Many social workers are facilitating training for staff, family, and volunteers, and they are also facilitating programming, often in collaboration with recreation staff or with community members with expertise in the arts to provide meaningful activities rather than busy work or kindergarten-like time fillers for those with dementia. So over to you, Candace.
Thank you. Thank you for this opportunity to be with all of you today. On a personal note, I was one of the caregivers to my loved one in a long-term care home during the COVID-19 pandemic. And if you're a loved one, I commend you for all of your strength, resiliency, and deep love during these difficult times. Thank you also to my colleagues who've explained what they have found about the vital role of social work in long-term care. I hope you will find it as reassuring as I did to know that there were dedicated staff, such as social workers, who were keeping your loved one's personhood at top of mind and priority through this time and helping to maintain connections in any way that they could. My name, again, is Candace Hind, and I am a registered social worker. In fact, I've been the only social worker at a long-term care home in southwestern Ontario for the past 8 years. I have a deep respect and affection for the residents, their loved ones, administration staff, community that we serve. There are thousands of stories to tell, but as you can imagine, but I will only share a few amalgams of these stories to illustrate my social work role in long-term care during the COVID-19 pandemic. I think there's a slide with me in full PPE, and that would be, familiar to the pandemic. And in a residence room, there would have been, even to deliver a piece of mail, gown and glove and sanitizing in and out. But I want to tell you that I haven't always looked this way. In fact, before COVID, I remember people coming and going from the home, hair down, no mask, no shield, and that's where we planted the seeds of some of this work. In those days, we could have no idea how the lives in the long-term care community would be turned upside down by this virus, or how the role of the social worker would be called upon in so many ways to help the community to stay connected, and most importantly, to keep a space for hope. In my role as a social worker, I've always focused on building deep relationships with residents and their loved ones. In my practice, I focus greatly on learning and understanding history, life history, relationships, and building trust to address psychosocial, emotional, spiritual aspects of the lives of the residents. A social worker is trained to meet the client where they're at and see what is important to them. My work often began in the parking lot of the building, sitting outside on a bench with a resident family and watching wildlife. We're on 5 acres, watching wildlife at the home and talking about their lives and interests. To some observers, this might have been construed as wasting time, but during the times of COVID, it turned out to be a precious and valuable investment. To illustrate as a story for an example, I've spent hours with a resident and her family building trust and relationship. We would sit outside when it was warm and watch the rabbits and the birds and talk about their residents' long love of reading, how her mother had instilled this in her as a child. And when this work began, the resident would read a book every 3 days and discuss her favorite authors. I paid close attention, of course. And years later, in the middle of COVID-19, her dementia had progressed significantly, and she could be disoriented and wander, confused. So during this time, it was a concern that we would not be able to assist residents to remain in their rooms, to socially distance and to stay safe. But in a case like this, I knew that she had a book by her bed, by her favorite author, where her glass of water was, where her reading glasses were, all of those kinds of things. And I was able to convince her that it's a vacation. And your mom says that you can stay in bed and read all day. And this was a huge treat. So she would literally respond with excitement, I can. And then we would read happily. She would read happily for like that for a time. And when she forgot that, we would start the process all over again. And I was able to develop a routine that we could repeat successfully and to pass this recommendation on to other shifts and other workers. And I was able to telephone her children with updates and provide reassurance. And it's because, and they trusted our patience and our knowledge of their mom. So this story is just used as an amalgam. It's an illustration that the social work role was to compassionately and creatively use life history and trust and help people stay safe in gentle ways through being mindful of their strengths and their preferences. And there were 120 residents and 120 different stories and interventions. Everything that you can creatively think of as a variation. And being trained and experienced with conducting clinical interview, gathering life history, having skills, taking time to read the room. What's in the room? What's not in the room? And to collaborate with loved ones allowed me to be a walking Rolodex of information. Ultimately, I was able to have a list of all of the residents and how to work with each one in successful interventions that we tailored to each person. Further, just like Never Swim Alone, we worked in a multidisciplinary and interdisciplinary team. As I mentioned, I have the utmost respect for my colleagues, and they acknowledge my expertise in mental health and psychosocial care. As a social worker, I could model and pass on techniques and practices that worked. During COVID, it became such tight working relationships that a colleague and I could look at one another and step in where it was appropriate. My skills in trauma-informed care, mental health, and person-centered care were needed and called upon constantly. As we've just heard about with all these new faces, agency staff, all of that kind of thing, there's no time to sit and read through years of progress notes. So I had to know all of the residents well and serve as a point person in order to provide for them to provide person-centered care and to take a holistic view of the resident, their life history, current realities, and the changes that were happening over time. Throughout the pandemic, psychosocial needs would change constantly. For some, the resoluteness of the early days faded into depression. And on the extreme end, we witnessed residents who were experiencing hallucinations, usually of others like grandchildren, late spouses, pets. Helping people through these experiences uses a lot of social work skills, training, and techniques. I worked with these residents to find effective coping techniques. For instance, if the visions were people that they were missing, we would practice breathing, talking to the person, using a rationale that they were coming to them to help them through this time. The most therapeutic intervention was sharing a laugh. It became social work currency and could help dispel sadness and loneliness. I found that a genuine smile, even from my eyes behind a mask and a shield, was an invisible bridge between people in an otherwise grave and serious environment. In the early days of COVID, sharing laughter was the closest I had to a magic wand to lighten the tension and the heaviness, even for a moment. And of course, it was prime interest to help maintain connections to others, to the world, even to themselves and their own personhood. We needed to maintain connections with loved ones by any means possible, whether it be through iPads, Windows, cell phones. I would hold my own cell phone number up and people would call. We'd use speakerphone, landlines, writing postcards. We would help in any way that we could. A big part of this was understanding who was family to the residents as they defined it. They were spouses, siblings, children, grandchildren, but sometimes they were neighbors, friends, volunteers from their church or club, or many would not be identified in our system as the POA, so we often had to find them. It was all about connection, keeping them apprised of what was happening in the outside world with the businesses and discussing family, what's going on. Everyone had a reaction. Even if they couldn't name it, everyone had a reaction. They all needed reassurances, a place where they could express these feelings and offer hope for brighter days ahead. An important social work role was keeping this space for hope. Social workers are trained to look for strengths Just as if you would look for troubles, you could find them. If you look for strengths, you will surely find them. And in those strengths, you can always find hope. I would say the cornerstone of my social work and long-term care practice is building trust and relationship. From that foundation, we can go anywhere. I think this pandemic has shown us that social workers can play a big part of the culture change that's happening in long-term care, and we can contribute to quality of life and to quality of care. Thank you.
Thank you, Candace, so much for sharing your story. And now we're going to invite back to the virtual stage Susan to pull apart more of the learnings and considerations for what comes next. Over to you, Susan.
Yeah, I want to make sure there's lots of time for questions, so I'm going to be incredibly fast here. But some of the learning that we've had about from our long-term residential care research is that teamwork is critical to care. Now, medical care is often done in a kind of control model. And this is really appropriate for acute care. When you're having a heart attack, you want people to move, respond, and do things quickly and swiftly. And it's really appropriate. But social care is a little different than that. It requires flexibility. It requires responsiveness. It requires teamwork. And the places that we investigated that were the highest quality were ones where all the workers, from cleaners to administrators, had job descriptions that included talking with residents as one of the job expectations. And while specific skill sets and knowledge absolutely transfer to quality of care, we found that rigid work hierarchies undermined it. We saw social workers like Candace facilitating this teamwork and making, and with their special training in group work, which I know they have, really producing that kind of teamwork when they were given this opportunity. But we also saw things that interfered with that. And one was where social workers were not employed directly by the home, but by a contracted company, and maybe were there only in and out. In our research, this employment relationship diminished possibilities for social work contributions to teamwork and the 6 other areas that I mentioned earlier, due to limited hours and availability and tendencies for more turnovers in these jobs because social workers moved on to better ones. There was a sense in these cases from other workers that these social workers were not really part of the team or the home. And that was also we heard from families that, the social worker wasn't reliably there and you just couldn't count on it. So we plan to continue our research on long-term social work and social services work with a focus on Ontario. And we're very happy to offer more information if useful. And I'm now going to hand it over, I think, to Michelle. Michelle, is that you coming back?
I think it's me and Sam coming back. Thanks so much, Susan.
Yes. So what we were going to talk a little bit about is, okay, we've told you what we learned, but now what? So I think that Susan really highlighted that we do need more research and to really explore what's working well in Ontario and what's not. But Michelle, I think your big call is for people to join the COP.
Absolutely. Yeah. So if you have a family member who lives in a home that has a social worker or social service worker, ask them if they're part of the community of practice that FCO and CLRI run on a monthly basis. If they're not, you can certainly reach out to me and we can get them registered if they're interested. Yeah, we're always looking for new folks to join. We have currently 110 people that are registered for that group. So it is growing and growing.
Which is incredible because when we did this presentation back early in the spring for the ministry's pandemic folks, we know that there was a huge uptake and interest following that. So please do share this back with the team at your home. Something else that we are keeping an eye on is the national standards implementation, because that does include about psychosocial care and social work, social services work would fit well into what's been planned there. And something else that we've also talked about is making a push to government, and there's some progress being made on this, is to include and fund social workers and social service workers in long-term care homes. There has been an announcement that's been made about monies being introduced for social work in long-term care, but we're still waiting for the details. Michelle?
Yeah, and I think the other thing is just wanting to see some clarity in terms of the scope of practice. And one of the things that we're embarking on with Susan is hopefully a collaborative research project. We're looking at applying for grants. So stay tuned, hopefully, for some more news from us on that. And the next slide just has a quote on it that I thought sort of captures the beauty of coming together, and how it gives us this visual around birds coming together and how they fly, and boost each other up. And I think, I've witnessed firsthand the power of peer support, and it is an incredibly meaningful way to help folks through hard times. And I'm sure many of you have experienced that as well through the many fabulous peer support programs that FCO leads. And then before we open it for questions, just wanted to highlight, we have a slide here with some different resources. If you're interested to learn more about the role of social work and social service work, feel free to explore some of these links and information. There's a webinar recording that actually has Candace presenting that was put on by OASW back in the early days of COVID, as well as some resources from the College of Social Workers and Social Service Workers and the Canadian Association of Social Workers. So you can share these with your home. If your family member lives in a home that doesn't have a social work role, feel free to share these tools and let them know that you came to the presentation and that you're curious if they might consider creating this important role.
And I think that speaks well to a question that's been posed. But before we get into that, here is contact information so you can reach out to us. But now we are going, and also if you want to learn more about the CLRI, that offers a wide variety of supports, tools, and services to long-term care homes. Check them out there. But on that note, let's transition to our Q&A. So the first question, and it really building off of what Michelle was just saying, what can family councils do to advocate for full-time presence of a dedicated social worker within their own home? What resources exist to support them in this advocacy? Michelle or Susan, perhaps, if you want to jump in, anything that perhaps we haven't covered in the session so far?
Well, okay, so first of all, the things that we've seen family councils do is develop tight relationships with the social workers in their home, but also really speak with folks like their MPP and with their regional health coalition, with other advocates, organizing around not only what social workers and social services workers do, but why it's important to them. Mm-hmm. And we've seen that repeatedly, where you get a little political and start connecting with others and and putting on a little pressure. And actually, we've seen that be tremendously effective. That sounds, I think, overwhelming for some people. I mean, you're already working to support a resident in long-term care, and it's just like, who needs another job, right? So it can seem really overwhelming, but that's where I think family councils and people working together, it becomes something that's quite, in my experience, people experience some joy, some satisfaction, and a place to put some rage, frankly, that can be quite helpful. I've seen some really amazing effects from some collective political action on these things.
Power of the collective voice and strength in numbers, absolutely. Michelle or Candace, is there anything you wanted to add to that?
Go ahead.
Oh, sorry, Candace. I was just going to say, I'd encourage, if anybody's perhaps, at a home where there isn't that collective kind of organization happening and you're just sort of one family member, perhaps without a counsel at the home, you could engage with the administrator or the executive director and just have a conversation and just say, has there ever been a social worker in this home before? Do any of your peers at other homes have a social work position, and just kind of plant that seed for them to maybe ask the next time they're at one of their meetings where they meet locally with other administrators nearby. Because I think hearing from other organizations that have the role can often help in convincing once they hear about and see the value. I guess maybe the other thing is, Sam, I don't know if this recording, I'm assuming the session's being recorded, so maybe share the recording of this with the home as well might be another idea. Candace, you go ahead.
All I was going to say is that there are some resources being developed right now. Susan's we've all pointed out resources for family councils and CLRI, and OASW has also a good, some policy briefs about staffing study and things like that. You can show this. There is some evidence. I know Susan's lamenting that not enough, but there is evidence out there that you can present in these different venues.
And those are all great ideas. And what I would add is, if you're, a family member or a family council that's exploring this issue, reach out to other councils in your area. See what other homes are doing, and so you can get sort of a lay of the land, but also hear from families about what benefits they've seen. So really looking at encouraging a home to do something rather than shaming them for not doing it. I think that would be always more effective. And when we're looking at having, someone come in to do that psychosocial support, coming into an environment that really welcomes them and understands their value, I would guess would go a long way. Next question. So the updated Fixing Long-Term Care Act includes more opportunities to engage families and get their input on important issues like quality improvement plans. So what role do you see social workers playing in supporting communication and the relationship between administrators, home leaders, and families? Homes are going to be doing more to engage families. They're going to have to. But what can social workers do to improve the experience and the relationship there?
Well, I'm going to start it off and then I'm going to see what you have to say, Candace. But the first thing that I think they've got to do is make sure that this gets into their job descriptions.
Yes.
So I think social workers can do a lot to facilitate family involvement and to encourage, work with family councils, work with individual families, and also encourage the development of family councils where they have been weak. So I think those are all things that social workers can do. The problem is that social workers do a ton of things off the side of their desk that are not in their job description, that are within their scope of practice, by the way, things that they are trained to do, but that they are not getting the credit for, the work time for, and is creating, yet another worker who is putting in too much overtime or who is leaving feeling that they've done a crappy job and then exits the sector because of problems with job satisfaction. So to me, job one is to get family facilitation on these things, given that it's in the legislation, to get that into the job description. And of course, I'm right there helping you because I will be talking with unions about this. I will be talking with employers about this. Candace, how does it look from your side?
Agreed. That is, and I'm really lucky because in my situation, they respect that this is, a family, this is meso practice, this is Candace, an area that Candace is strong in. So, but I agree that it needs to be written right into the job description. And I love, it is so vital to work at that meso level of practice and to be able to be a conduit, conflict resolution, yes, but also just knowing the holistic view of the family. I don't know how many times in progress notes I've said family systems, working because it's all interconnected. So anyway, I just agree. It needs to be recognized. And I'm just lucky that anecdotally they do recognize my work where I am.
Which is great. Michelle, is there anything you wanted to add to that question?
Maybe I think there's also opportunity for social workers to help identify and bring diverse voices to the table. I think sometimes when a home identifies like who would be the right family members to join this group, sometimes it can be the same folks that come to mind. So I think, we're really reflecting on how do we get diverse perspectives there around the table might be a key role.
Well, and that's a great, and so thank you for all of that. I think that's really valuable and speaks to really how to do something well and look at relationships and center, quality improvement within a relationship and ensure that social workers are part of that relationship. I know we're running a bit over, but there's one last question I want to pose. And it really speaks to, I think, Michelle's point around diversity. And we know that Ontario is an incredibly diverse province and the beauty in that. But then there's also, some challenges in making sure that homes can meet the needs of residents from different walks of life. So it's a bit of a two-part question. One is how can we ensure that there are social workers who are part of various communities. So for example, if it's a Filipino mostly home, ensuring that they have access to culturally affirming and supportive social work practices. So one, maybe that's a bit of a enticing people to work in social work and long-term care. But then also what resources maybe are, if there's any specific out there that that speaks to diversity and equity in long-term care from a social work standpoint, so that way we can ensure that folks aren't going back into the closet and that they're not facing racism or homophobia or transphobia or what have you. So how do we get people into the sector, and what do we do to build it and make it better? I know it's a big question, but who wants to start?
Okay, I'll start again.
Susan, up first.
I can always do it, but I'm going to tell you that at Carleton in October, we have a session already scheduled and guest speakers already lined up to talk about the challenges of recruiting racialized and immigrant and queer staff. And we are focusing particularly on racialized staff in our particular session, knowing that across gerontological sites, long-term residential care being one of them, but also community care as well. But across gerontological sites, there's way too many people that look like me. And we need to change that up. So we've actually got workers who are racialized social workers who are working in long-term residential care, who are working in community care, in gerontological settings, who are going to talk about the challenges that they've experienced, but also about the value of the work and about how we can transform this. We also have a wonderful doctoral student who's just about to defend, whose work has been on the whiteness of long-term residential care in Canada, and about how that has been experienced by who we are counting on more and more as immigrant racialized workers, but also immigrant racialized families and what their experiences have been in long-term care, and how unwelcoming these settings are, and how they have to be transformed. And our focus is always on how we can improve. We can moan, problems are easy to see. It's harder to see how to improve. So the focus of this session is how to improve. And certainly we are working on all of that with great interest.
Excellent. Candace, any thoughts?
I agree again with everything that Susan has just said, that all of you have just said. Indeed, there's work to be done, but indeed, not just the non-judgmental, we always go on about social work, but celebration of differences and celebrations that can go on. I find long-term care to be such an accepting place. And so I think there's a lot to build on. There's a lot to build upon and go forward in the vision that you're saying.
Yeah, using those social work skills and that appreciation of difference to create places where people truly feel that they belong. I think that's a goal, part of a vision that we all share. Michelle, anything to chime in about?
I'll put a little plug if I can for some of the CLRI resources. One of the projects that I lead is on supporting equity, diversity, and inclusion, and we've developed a number of resources, toolkits, posters, calendars that can help support homes in being more inclusive. There's lots of recommended promising practices that come from the literature, that come from other homes, kind of following Susan's style of identifying the good and encouraging others to follow suit. So I would encourage you to explore those resources, share them with the homes. I mean, I know the question was asking specifically if there's social work resources. We've had social workers part of the work of developing these tools. They're resources really for the whole team, for the whole community, for the whole organization, because this is stuff everybody should be talking about, not unique to one profession. But yeah, check that stuff out.
Yeah, and the only other resource that I would mention is that Ottawa Senior Pride actually has developed some absolutely phenomenal resources for long-term residential care that are being used across the country. That organization, I can't say enough about the work that they've done to really help us do better in long-term residential care and community care. And so I really encourage anybody to check them out. Their website is phenomenal, Ottawa Senior Pride.
All right, we will post a link to that. So thank you so much, Michelle, Candace, Susan, for your presentation today, for joining me to discuss this really important topic, and for the work you're doing to push the envelope on this, to explore and bring to the surface what's working well and highlight where we can improve. So I do agree that it's only by looking at both, and we can talk about problems till we're blue in the face, but unless we also have a vision or a goal that better to strive for, we will get stuck. So Susan, your research, I think, points well to that. Michelle, your leadership of the community of practice, and Candace, thank you for sharing that story, because I know that you are one of many who are out in the field doing the important work day in and day out to make a difference in the lives of families and residents. And I know that your story will motivate some of that change, because it's what we want. It's what we want to see. So in closing, thank you again to all of you, and I look forward to continuing the conversation and the work on this important topic.
Thank you.
Thank you.
Thank you so much.
Thanks. So to those of you who have joined us today, a big thank you for spending your time here for another one of our virtual conference sessions. As I said earlier, make sure to join us Wednesday night for the third session of the book club on Happily Ever Older. And then join us Thursday afternoon for Deborah Bhakti's talk related to her book as well. And then 1 week from today in the evening, we will close out our month-long celebration with our evening social and magic show. All details available on our website, along with, if you want to become a friend of FCO, details are there as well. Until later this week, thank you so much for joining us. Stay well, stay safe, and we will see you soon. Thanks, everyone.